Hi, this is Brooke Bailey, and I examined the changes in wrist flexor and extensor EMG amplitude with the onset of submaximal isometric contraction fatigue. Typically, during fatigue, muscles must recruit more and more motor units in order to maintain a specific force output. A lot of studies will use EMG amplitude to correspond with a muscle's level of activation during fatigue in isometric contractions. A lot of studies have found that EMG amplitude should increase as the muscle fatigues, indicating that more and more motor units are being recruited and then reflecting on the muscle's activation level. There have been other studies, however, that have found unchanged or decreased EMG amplitudes during fatigue. We used 8 subjects, and all of which were volunteer students from the Regis of Doctor Physical Therapy program with average age of 23. Exclusion criteria includes latex allergies and neurological deficits. For our methods, we used established EMG testing protocol where 2 electrodes were placed over the muscle bellies of the major wrist flexors and extensors after first palpating for placement accuracy. The subject was then asked to perform a maximum grip test, isometric, on a hand grip dynamometer to, one, validate the placement of the electrodes and also to record the maximum grip force and peak EMG amplitude for the flexors and extensors. The subject was then asked to maintain an isometric grip force of 25% maximum, and every 15 seconds we recorded the average peak or the peak EMG amplitude and force. We then calculated the percent of maximum EMG amplitude at each interval for each subject, then averaged these data and plotted the values on the y-axis with time on the x-axis. The yellow graph represents the wrist flexors, the blue graph represents the wrist extensors. After calculating the slope and R-squared values for the lines of best fit of both of these graphs, we saw an average decrease in the overall EMG amplitude with time and fatigue. The slight decrease in EMG amplitude is attributed to a decrease in motor unit activation, although we did not interpret this to represent the muscle as a whole. Around 180 seconds, a couple of subjects reached fatigue. At this point, we saw a sharp decrease in the standard deviation of the flexor data, suggesting that the remaining subjects had more fatigue-resistant motor units. For clinical application of these results, we decided that exercises should be tailored to patients based on the proportion of fatigue-resistant motor units versus fatigue-vulnerable motor units, taking into consideration the percentage of maximum contraction that the patient is being asked to perform.